Bismillahirrahmanirrahim. A 27-year-old woman, gravida 2 para 2, is evaluated on the postpartum floor due to generalized tonic-clonic seizure that occurred 30 hours after a vaginal delivery. The patient was induced at 38 weeks of gestation via an oxytocin infusion for pre-eclampsia with severe features. She received a magnesium infusion for seizure prophylaxis that was discontinued 24 hours after the delivery. Her pregnancy was complicated by insulin-dependent diabetes mellitus, and insulin drip was used during labor. This patient had a spontaneous vaginal delivery complicated by a postpartum hemorrhage that was treated with bimanual massage and oxytocin bolus and infusion. Temperature is 37, blood pressure is 128/82, pulse 78 per minute, and respiration are 18 per minute. Physical examination revealed a lethargic patient with no focal neurologic deficit. Laboratory study drawn immediately after the seizure include the following: hemoglobin 10 gram per deciliter, platelet 160,000, sodium 112, potassium 3.6, chloride 100, glucose 78, calcium 9.6, magnesium 6.3. Which of the following is the most likely cause of this patient's seizure? So, as I told you that there is always there is a hint in the question. So the first hint is that the patient is suffering from the tonic-clonic seizure. So we have to see that why the patient is suffering from tonic-clonic seizure, because her vitals are also normal. She doesn't have any proteinuria that we can go toward the eclampsia. But we have to know the cause of the tonic-clonic seizure of this patient. So first of all, the first hint is that the patient received oxytocin infusion for pre-eclampsia with severe feature. This is the first hint. The second hint is the patient also received oxytocin bolus and infusion for the postpartum hemorrhage. As we know that the most common cause of postpartum hemorrhage is uterine atony, and oxytocin work as a oxytocin contract the uterus, which help us to deliver the baby. And the third option is sodium. As we can see that this is a sodium level. So come to the first hint is this is the first hint: oxytocin infusion for pre-eclampsia management. The second hint is oxytocin infusion for postpartum hemorrhage. This is the second hint. And the third hint is sodium level. As we know that the normal sodium level is between 135 to 145 milliequivalent per liter, and here the sodium level is 112. So this is the three hint. So based on the three hint, we can easily diagnose that what the patient is suffering from. And this we can also we can also highlight the magnesium level, because the magnesium level is also disturbed. So based on these three hint points, we can go directly to the choices, that which of the following is the most likely cause of this patient seizure. So as we know that there is the patient received oxytocin infusion for pre-eclampsia feature. The second is also the oxytocin infusion and bolus the patient receives also is also received for postpartum hemorrhage. And the third one is the sodium level is markedly decreased. So this patient is suffering from hyponatremia based on hyponatremia, and the correct option is oxytocin toxicity. Why is oxytocin toxicity? Because oxytocin is similar to ADH. Oxytocin is similar to ADH. Oxytocin is similar to ADH, and ADH abbreviation is antidiuretic hormone. So what the antidiuretic hormone do? Antidiuretic hormone goes to the nephron and retain the water. When the water is retained, the intracellular fluid goes up and the sodium level goes down. So oxytocin is similar to ADH. Prolonged administration of high doses of oxytocin can cause water retention. As a result of water retention, hyponatremia will be developed, and hyponatremia will result into seizure. So the choice F is the correct one, oxytocin infusion. Now come to the incorrect one. That why the choice is incorrect. The choice is incorrect because severe blood loss anemia can cause shock, and the symptoms of their shock include hypotension, tachycardia, mental status changes. So this patient is not suffering from any shock. The choice B stated alcohol withdrawal. Yeah, it is true that alcohol withdrawal can cause tonic-clonic seizure. This patient doesn't have any history of alcohol abuse. The choice C, hypoglycemia. This is also true that hypoglycemia can cause seizure, but this patient euglycemic at the time of her seizure. But this patient is euglycemic at the time of her seizure. So this is also incorrect. The third one is intracerebral hemorrhage. As we know that intracerebral hemorrhage mostly occur from hypertensive crisis, and the symptom of that hypertensive crisis usually occur is headache, vomiting, lethargy, and fog neurologic deficit. And this patient is doesn't suffering from any of these symptoms. Choice E stated magnesium toxicity. So magnesium toxicity typically present with hyporeflexia, lethargy, headache, respiratory failure, and cardiac arrest. And none of these symptoms the patient is suffering from. But the magnesium toxicity doesn't result into seizure. This patient magnesium level is in therapeutic range for pre-eclampsia management, and the magnesium become toxic at the concentration of 8. Magnesium become toxic at the concentration of 8 milligram per deciliter. More than 8 are equal to 8. So this is the toxicity for magnesium. So let's revise again that why the choice F is correct one, oxytocin toxicity. So first of all, as we know that oxytocin, more severe oxytocin, prolonged administration of oxytocin act like ADH. Not little bit oxytocin can act like ADH. So prolonged administration of oxytocin can act like ADH, and ADH goes to the nephron. ADH goes to the nephron. This is a roughly drawn nephron. From ADH goes to nephron and work on the nephron to retain water. So water retention will cause decrease sodium level, and sodium will result into seizures. So this is oxytocin infusion will cause we will cause increased amount of water retention, and this will result into seizure.